Javier Becerra, Secretary of Health and Human Services, and Miguel Cardona, Secretary of Education. Secretary Becerra, Secretary Cardona, thank you both for joining us today. I'm very pleased to welcome you back before this committee, and I look forward to your testimony. Secretary Becerra, we will begin with you.
Chair Murray, Ranking Member Burr, it's a pleasure to appear before you alongside Secretary Cardona. At HHS, the health and safety of our students, their families, and our school personnel is our top priority, always, not just during a pandemic. COVID has robbed so much from our children: a safe and comprehensive learning environment, a normal school year, time with mentors and friends. For some, the costs have been even greater. Roughly 40,000 children have lost a parent to COVID-19, and more than 1.5 million have lost a caregiver. The numbers only tell part of the story. It's the empty chair at the dinner table, the open seat in the bleachers. It's the quiet homes and crowded hospitals. It's not having the chance to say goodbye. That's the real story. We owe it to our children to make the classroom as safe, nurturing, and instructive as possible. Every step we take and take together can save lives. That's our mindset at HHS. Thanks to President Biden's leadership and robust funding from Congress, our department has made critical investments in COVID mitigation to help schools stay open safely. We've learned a great deal in 18 months. Vaccination, masking, testing, increased hygiene, distancing, and improved ventilation all can significantly reduce COVID-19 transmission when layered appropriately. And make no mistake, vaccinating Americans against COVID is the most effective prevention strategy for our schools. The science is clear. I call your attention to Chart 1. While the COVID-19 rate for children has increased nationwide, data from August show that children and adolescents in low vaccination states are being hospitalized at 4 times the rate of their peers in high vaccination states. Add in data for adults, and the lesson is undeniable. As you can see from Chart 2 today, COVID is attacking our children, our least vaccinated population, at rates even greater than adults in states with low vaccination rates. That's why this administration is taking several steps to turn the Delta variant tide. HHS will require the nearly 300,000 educators at Head Start programs to be vaccinated. Our Centers for Disease Control and Prevention, CDC, is working with partners to broadcast the importance of vaccinating children, teachers, and school personnel. HHS is also coordinating a public education campaign that lifts up more than 14,000 trusted community voices to remind everyone that vaccinations are safe and effective. Our Food and Drug Administration has reaffirmed it will follow the science on COVID-19 vaccines for children younger than 12. The agency is working around the clock. I'm hopeful that pediatric COVID-19 vaccines will become available in the coming months for children 5 to 11 years of age. Our National Institute of Health, NIH, is working to get parents and care providers the data they need to make good decisions for their kids, both today and for the long term. And thanks to the American Rescue Plan, community health centers have administered nearly 500,000 COVID vaccines to 12 to 18-year-olds and conducted more than 2,500 vaccination events at school-based clinics, mobile vans, and pop-up clinics. Testing is another cornerstone of our strategy. In April, HHS provided $10 billion for screening testing to help schools reopen safely, and more than $2 billion to scale up testing in underserved populations. We partnered with the Department of Defense to make $650 million in investments to expand testing opportunities for K-8 schools and underserved congregate settings. Masking has also shown extraordinary results. On September 24th, CDC published data that show schools without in-school mask requirements were 3.5 times more likely to have a COVID outbreak than schools with an in-school mask requirement. The pandemic is not only taking lives, it is devastating our kids' mental health, and we're not waiting to act. In May, HHS announced $14 million from the American Rescue Plan to expand access to mental health care by integrating telehealth services in pediatric care. We've made the largest investment ever in mental health and substance abuse block grants to states. And in August, our Substance Abuse and Mental Health Services Administration, SAMHSA, announced additional grants to strengthen resources for our nation's youth. This is just a snapshot of our efforts. Over the past 6 months, I've met with parents and teens in Georgia, visited the tribal leaders in Seattle, and farm workers in California's Central Valley. I met with faith leaders in Oklahoma, families in Dallas, health workers at hospitals in New Orleans. Madam Chair, I've seen firsthand the resilience of our people. They are counting on us to keep their children, tomorrow's leaders, healthy and educated. But as Robert F. Kennedy reminded us, their future is not a gift or a guarantee. It is an achievement. I appreciate your support for HHS through this crisis, and I'm committed to working with all of you to achieve the healthy future for our children, and it's what they deserve. Thank you.